Hello, good afternoon. I'm Danielle Boykin, and despite my headshot that looks like I'm selling real estate, I actually work for the state of California, Department of Public Health. My change management capstone is regarding incorporating health equity into emergency preparedness and response planning. Since we seem to be recording, I will add the disclaimer that this presentation does not necessarily reflect the views or opinions of the California Department of Public Health or the California Health and Human Services Agency. Next slide, please. I think you're all aware of the agenda already, so for brevity, I can skip this one as well. Sorry, I know you're all waiting because I'm last, but I will talk fast. Okay, so a health equity challenge is to incorporate health equity and emergency preparedness and response planning, so including the access and functional needs of disproportionately impacted populations and communities most impacted by disasters. So as background, I'm with the Center for Preparedness and Response, and we're responsible for overall statewide coordination of public health preparedness, mitigation, response, and recovery efforts. That includes statewide planning for public health disasters and emergencies, distributing, monitoring, and funding for disaster planning at the local level, developing and maintaining standard public health and medical emergency management system for local and state entities, operating our Emergency Operations Center, which is the Medical and Health Coordination Center, and planning for receipt, storage, staging, and distribution of public health and medical equipment, pharmaceuticals, and other commodities through the state of California and also from the Strategic National Stockpile. So all the planning requirements are applicable under a number of government code and fund sources, including Public Health Preparedness Program, Hospital Preparedness Program, cooperative agreements, state pandemic influenza, surge capacity, future public health initiatives, many others. This is just some quick background on some of these plans, and California relies on a strong mutual aid system. So we're supporting multi-agency coordination and recognizing the significant role of local and county governments and agencies in emergency preparedness and response. So within California, we have 58 counties, 61 local health departments, 41 healthcare coalitions, medical health operational areas, regional disaster medical and health coordination, which is our mutual aid regions in the middle there. And on the right-hand side, we have 41 different healthcare coalitions, and we manage over 70 local subrecipient agreements with local health jurisdictions, local emergency medical services agencies, health and healthcare associations, and even other state departments. So I think all of that just means that basically planning is complicated. So I've listed a couple of examples here, but all of those plans have a lot of subcomponents. So when we're talking about readiness plans, we're also talking about training and exercise plans. Response planning is information sharing, resource management, workforce readiness, medical surge, patient movement. I can keep going, but I won't. So how do we build a team to make all of these updates when we know that public health disaster events exacerbate existing inequities and cause disproportional harm? We also have to understand at the state level, we're supporting an incredibly diverse population. So over 39 million people, the world's fourth largest economy, and a wide ranging landscape of lived experiences in differing environmental, occupational, economic, cultural, and political climates. We also need to respect local jurisdictional authority and capacity. So we need to really identify the appropriate participants. We also, everyone on this call knows that disproportionately impacted populations have existed forever, and it's not a new concept for most of us in public health or healthcare, but sometimes we need a large incident or a pandemic to really highlight it and remind the rest of the world. So most of our modern efforts on planning stem from large-scale incidents, 9/11, Hurricane Katrina, infectious disease. We just had a pandemic, national supply shortages, those types of things. So for the most part, these plans exist already in some capacity, but we need to regularly maintain and update them and identify those appropriate partners. And that's kind of the challenge. So depending on the plan, we have partners internally here from infectious disease, environmental health, health equity, and emergency management. Many others. Local government includes our local health jurisdictions, our local emergency medical services agencies. Health and healthcare is a bunch of state agency partners, as well as healthcare organizations and associations. And community partners includes representatives from community-based organizations, non-governmental organizations, and many other strategic partners. So what we try to enter into these, especially the planning, but also the exercising and the training, is adopting the nothing about us without us mindset. and including all the partners, not only in the planning process, but also in those training and exercise plans to ensure adequate evaluation and ongoing improvement planning. Sorry, I know I'm talking really fast, so I'm trying to get through it. Next slide, please. Okay, vision and strategy. So our vision, prepared and resilient communities. And our goal is just to update and maintain emergency preparedness and response plans. So we're including considerations for communities most impacted by disasters. As mentioned, most of those plans themselves already exist. The challenge is updating them with appropriate health equity considerations. So much of the initial strategy is really identifying those partners and prioritizing the approaches as listed here. So next slide, please. Anticipating the 2-day strategy and vision event, we have the mock agenda or high-level goals that we want to accomplish in that space. I think I'm missing a picture, I'm sorry. So just here's a couple of high-level things that we want to achieve. Next slide, please. Communications plans, we have multiple audiences here. So internally with staff, we have our leadership that need to share that need and the vision. We also want to empower staff with training, knowledge, and the ability to pursue these updates. And engagement of appropriate partners that represent or serve these communities really elevates effective planning and exercises in support of operational readiness during a response. The external messaging also has multiple audiences. So the primary audience, usually when we're talking about the state and when we're issuing things like statewide planning or guidance documents, that's going to be local government. However, separately, we want that community involvement. So clarity and consistency with messaging, culturally and linguistically appropriate materials, as we have all heard, web posting, infographics, digital toolkits, things like that. So next slide, please. For goals and implementation, we have some practical short-term goals listed here. The access and functional needs of communities most impacted by disasters must be incorporated into preparedness plans to facilitate operational response readiness and successful response outcomes. We also want to make sure we're continually updating based on lessons learned, environmental considerations, real-world experiences, of which we all have many, evaluation components, and continuous improvement. So that is a wrap. Thank you.